Good morning, everyone, and yet one more lecture about hematology. And this one, I would like to start with approach to lymphadenopathy, because we are studying hematology, and in hematology, one of a very important, like every units or every system have some presenting sign and symptoms. For example, when we were studying cardiology, we study chest pain, we study dyspnea, we just study palpitations, things like this. And when we, for example, study abdomen, we study abdominal pain, we study diarrhea, jaundice, vomiting, and all these things. Okay, so in hematology, of course, one of the symptom, you can say, symptom, the patient can present with the complaints of lumps and bumps in the body. Okay, which actually is the lymph nodes swelling. But of course, like the patients, they when they don't know, uh, either it's a tumor or what, why there is swelling. So a very important complaint is the lymph nodes can get swollen. For example, we were discussing anemia, and we discuss a lot of sign and symptoms for anemia. And the patients can present with dizziness and all the stuff. And in hematology, like one of the symptom can be like lymphadenopathy, or it could be, for example, enlargement of the liver or hepatomegaly, or it could be enlargement of the spleen called as splenomegaly. So lymphadenopathy, the short form is LAD. So whenever I write LAD, like in the rest of the lecture, always remember like what I'm talking to, what I'm talking about. Okay. So actually, there is a lot of uh, causes of lymphadenopathy. Okay. First of all, remember that there could be a localized lymphadenopathy, or there could be generalized. Okay, lymphadenopathy. What are the areas where there is where the lymph nodes are present? Of course, there is submental lymph nodes, there is submandibular lymph nodes, there is uh, what you can say, cervical lymph nodes, and there is like anterior group, posterior group, or the deep cervical lymph nodes are also there. There is axillary lymph nodes, and there is lymph nodes around our elbow joint. There is lymph nodes called as para-aortic lymph nodes around the aorta. There is lymph nodes inside the chest, in the hilar region of the lungs, and there is lymph nodes in the inguinal region, and there is lymph nodes in the popliteal region. So simply uh, there is lymph nodes almost every part of the body, and sometimes these lymph nodes can get enlarged and can get swollen. So of course, like the patients take it as lumps or bumps. So of course, in the history you will found the complaint of this thing, that doctor, my lymph node is enlarged. So what could be the most possible cause? So of course, like first of all, we must know what are the causes of lymphadenopathy. And when we know the causes of lymphadenopathy, then we must know how to ask history about different, to rule out different causes. And once we know, for example, what are the causes, and we had done the history to rule out different causes, then we go for the examination. And in examination, we examine the lymph nodes as well as the other parts of the body, um, to reach certain diagnosis. So in short, when we are dealing with any lymphadenopathy, so we must know the causes, or the differential diagnosis, you can say, causes or differential diagnosis of lymphadenopathy. Okay, lymphadenopathy in any patient, of course. When we say localized lymphadenopathy, and one thing is generalized lymphadenopathy. Localized lymphadenopathy, of course, it could be result of some localized problems, okay, but mostly, we get more concerned, what you can say, um, we get concerned when there is generalized lymphadenopathy. Like localized lymphadenopathy, for example, if it is in the cervical region, so think about some pathologies in the head and neck. If they are in supraclavicular region, uh, think about again some uh, pathology in the GIT or in the chest. As you know, in the axillary lymph node, it could be females who have breast cancers, for example, or conditions like cat scratch disease give lymphadenopathy in the axillary region. Epitrochlear region, there can be lymphadenopathy, or simply uh, localized or generalized, they can be anywhere. So, okay, we will divide it into two parts. Causes of generalized lymphadenopathy. First of all, we will talk about this thing, and then, of course, we are going to talk about what you can say, uh, localized one. Okay. So, let me insert a table, and then I am getting good skills to use, what you can say, PowerPoints and Word. Never had this thing. So, by the way, this table is big. We don't want much of these blocks. I will try to use them, by the way. Lymphadenopathy could be reactive. Okay, uh, like whenever there is any infection, you can say, um, in the body. And when we are talking about generalized lymphadenopathy, so of course, a generalized type of infection all over the body. So, of course, the lymph nodes can get enlarged all over the body. It could be inflammatory, when some inflammatory process is going on in the body. And it could be neoplasms or neoplastic lymphadenopathy. Okay. Of course, we try to search out the cause. And when you talk about the reactive one, of course, the infections could be bacterial, it could be viral. Um, I think very easy. Like you guys are good in this thing now, should be good by this time. With this thing, it could be parasitic infections, and it could be, um, for example, fungal infections. Okay, so bacterial infections, viral, parasitic infections. All these things can give generalized lymphadenopathy. For example, I will give you the example of tuberculosis. It can lead to uh, generalized lymphadenopathy. Syphilis, okay, can give. Not just these, like Lyme disease is very important. By the way, I should add here Lyme disease, very important cause. Okay, Lyme disease and TB and syphilis and brucellosis, and there are many. And viruses, again, viruses can give generalized lymphadenopathy. Epstein-Barr virus, cytomegalovirus, HIV virus, and so on and so forth. Viruses, all viruses can give. Parasitic infections like toxoplasmosis, or fungal infections like histoplasmosis. So I would rather like to write one, toxoplasmosis, or in fungal, you can remember histoplasmosis. So it's like all of these, they can get what you can say, generalized lymphadenopathy. When we come on to the inflammatory one, again, it could be, now think about the first of all, the rheumatological conditions, or for example, rheumatoid arthritis can give, dermatomyositis can give, SLE is a very important example, which can give. So all these things, well, like collectively, they are called as collagen vascular disease, collagen diseases, by the way. Okay, so all the collagen diseases can for sure give lymphadenopathy. Drugs can give lymphadenopathy, and sarcoidosis or amyloidosis. Okay, these are infiltrative type of conditions, and serum sickness can also give. So, what about the drugs? By the way, drugs are many. Um, there's a long list. Um, Lymphadenopathy can be a side effect of many drugs. Mm, Penicillins can give, sulfonamides can give, phenytoin can give, cephalosporins can give, allopurinol can give. Okay, write a few here. Penicillin, allo, allopurinol can give. So many drugs. Okay, phenytoin can give. There is a big list of drugs which can give lymphadenopathy. And what you can say, neoplastic, simply cancers. It could be lymphoma, it could be cancers, okay, it could be lymphoproliferative disorders. All of these can give generalized lymphadenopathy. So if we will talk about, for example, the causes of localized lymphadenopathy, again there can be many reasons for that. Like it could be again acute, one could be reactive, or you can say, which is of course a localized infection. Okay, so localized, of course, we would go, because we are studying localized. For example, if I will talk about cervical, okay, cervical, like which are in the neck. So again, see, what can be the causes of cervical lymphadenopathy? Think in the same way. Infections, which could be bacterial, which could be viral, which could be anything. Malignancies, ENT malignancies can give. Okay, of course, like they are like, or any ENT, not even NT, any malignancy in the head and neck can give. So if you will talk about the supraclavicular, this one is an interesting story, by the way. Supraclavicular lymphadenopathy. This is interesting because if you know the lymphatic drainage of the abdomen, they are what you can say, uh, like drain in the left side, left supraclavicular fossa. Okay, and whenever there is enlargement of lymph nodes in that area, we always think about intra-abdominal causes. Okay, so one of a very important thing. So supraclavicular should be divided into two main categories. I will divide it into two main categories, as I told you, right one and left one. Okay. So whenever there is right supraclavicular lymphadenopathy, think about chest causes like mediastinal lung cancers. Okay, esophageal cancers, all this one can give lymphadenopathy. But whenever it is like the supraclavicular lymphadenopathy is on the left side, think about the abdominal causes like gastric cancer. Okay, gastric cancer, or you can think about what you can say, pancreas cancer or pancreatic cancer. Okay, as well as renal cancer, or even testicular cancer can give that one. Okay, so all those things can give. So when the lymphadenopathy is what you can say in the axillary region, very important, you can say, in females, think about breast cancer. Okay, and rest is the same story. Any infection, for example, cat scratch disease, because most of the time, the cat, they scratches on the hand, and cat scratch disease can give lymphadenopathy. So cat scratch disease can give, breast cancer can give, or any infections, in the upper limb, of course, like they will give enlargement of the lymph nodes in the axillary region. So this thing, and so on and so forth. Of course, like we will not discuss like each, because but make a concept like this, that what kind of areas and what kind of structures will be there, and think about infections, inflammations, and malignancies. And of course, like you are going to reach the point, right? Once, like, of course, if we know what are the causes of lymphadenopathy, then of course we must go for the what you can say, uh, like examine a history. Okay, so for example, if anyone will come for history, uh, what you have to rule out, what you have to think about, you will think about, uh, first of all, you will ask, like, where is the lump or bump? Okay, how long? Okay, progression, and any associated symptoms. Okay, see why. uh, I will give you a simple scenario. Someone have a supraclavicular lymphadenopathy, and it is there for last 6 to 8 months, and the person have mild grade fever, he lose a lot of weight, and he feels sweaty, anorexic, fatigued. See, pointing more towards the cancer. Someone who have a lymphadenopathy or a lump appeared for the last 3 days with high grade fever, uh, with, of course, no weight loss, 3 to 4 days, painful, sounds more like infection. Okay, so of course, like rest, you will you are going to talk about the same history. Remember OD para, onset, duration, progression, aggravating features, relieving features, as well as associated features. Okay, so simply you have to see either it's acute, or either it's chronic. Okay, either it's localized or generalized. Okay, uh, you can check the constitutional symptoms, which are also called as B symptoms. For example, mm, fever. Okay, for example, weight loss. For example, night sweats. So see, you like this one will cover. If you will ask these questions, guys, it is going to help you in diagnosing malignancies, in diagnosing infections like tuberculosis and all these things. Okay, ask about exposures. What if they have cats, pets? Cat scratch can be there. Tick bites, Lyme disease. If you remember Borrelia burgdorferi. Okay, uh, unprotected sex life, HIV. Okay, so this is uh, how we approach. Okay, so like when we will study cancer, for example, if someone have pruritus with these symptoms, there is a thing called as Hodgkin lymphoma. Maybe they have Hodgkin lymphoma, and that's why they have this thing. Okay, So yes, very important. Ask about medications, okay? Because medications can also cause lymphadenopathy, okay? So rest like is all like I'm not saying like we don't have to ask other history, but travel history, allergy history, family history, uh, social history, we will ask everything. Then we will go for clinical examination. In clinical examination, guys, we like the same things, journal appearance, you will check, okay, how the patient looks like. You will take the vitals of the patient. You are going to check, examine the lymphadenopathy. You have to differentiate either it's generalized or it's localized, okay. You will see this thing. And what else? What else? Yes, you will check for other signs like now this thing is important. See, if you are suspected tuberculosis, you will do examination regarding to tuberculosis. If you will are expecting Lyme disease, examine regarding that. Okay, so splenomegaly or hepatomegaly, many of the cancers, they get this thing. Okay, so we are going to look for these things in the patient, of course. Okay, this is the examination part. Now, in examination, one very important thing, guys, is to understand how, like when you will examine, you have to examine that particular part. Okay, for example, either it's localized or generalized. See, whenever we examine any lump, uh, there are many mnemonics again. We check what is the size, what is the site, what is the how the surface is. Okay, site, size, surface. We check the color. We check the consistency. Uh, we check either it is fixed to the underlying structures. We check what is the temperature. We check what is the like either it is fluctuation, there is fluctuation or no fluctuation. We see either there is any tenderness or not. So uh, there are many mnemonics to examine the lump. Okay, any swelling, site, size, surface, color, consistency, temperature, tenderness, fixation to the underlying and overlying structures, and you can simply see the compressibility of that structure. Okay, very important things. Cancers, they they involve the joining structures. They are fixed. They can invade the other tissues. Benign one, they are not. When you are going to press it, you will see fluctuant. Maybe it is watery inside. It's a cyst. If it's a hard tumor, maybe like this. If there is no pain, no tenderness, point more towards cancers. If there is pain, point more towards what? Uh, Infection or inflammation. So uh, again, I will put a table over here. Okay, insert a table, and how many we need. Okay, I don't know, I can fill it up or not, but I will try. For example, if I will say that oh, oh, okay, so for example, uh, let it make like this way, that you are examining a lump and these are the features which you catch. Okay, features. You will check, for example, consistency. You will check like the mobility. You will check the tenderness, and you will check the size. Okay, so to differentiate either it's inflammatory or either it's neoplastic. It's more like a cancer. Consistency of inflammatory are mostly rubbery, okay, whereas the consistency of neoplastic is firm, or you can say they feel like hard masses. Mobility, they will be mobile, freely mobile, and here they will be fixed or immobile. They are they affect the surrounding structures. Okay, they are tender. They are non-tender. They are mostly less than 2 centimeter in size, and they are mostly more than 2 centimeter in size. So see, when you will finish examination, you would have a lot of idea, what you are dealing with. So what you will be doing, simply you are going to correlate all these things, okay? Correlate these findings, your other clinical findings with the history you took. You will reach to some certain diagnosis, of course. So actually we are doing approach to lymphadenopathy, okay, before going to the cancers or other conditions. What are the investigations we can do? Now, if you know these causes, and as we are studying this thing as a topic, so we have to write all the investigations. See, start with the basics. CBC, ESR, CRP, very important, very helpful. Okay, blood film to catch any blood cancers. Okay, so if there is generalized tuberculosis, you can do tuberculosis test. You can do HIV test. See, I will talk about all the causes which are right over there. You will do syphilis test. You can do infectious mononucleosis test. Okay, EBV virus I'm talking about, Epstein-Barr virus. Uh, to rule out all the collagen vascular diseases, you will do serology of all the antibodies like anti-nuclear antibody. Okay, so this thing. You can do chest imagings. Simply any type of imaging to rule out tuberculosis, cancers, and all this stuff. If you can see the lump, you are confused, you can do biopsy of that lump. Okay. Nowadays, biopsy can be done by fine needle aspiration biopsy or fine needle aspiration cytology. Okay. So this thing, um, rest like ultrasonography can be done. CT scan can be done. Okay. So of course, like all these investigations and many more, by the way, to catch all these conditions. Okay, any one of these conditions, of course. But in reality, of course, we go logical. Okay, whatever we found, we do logical investigation. What is a treatment? Simply, guys, treat the underlying cause. Okay. So this is about like what you can say lymphadenopathy, and I will add one more thing in this lecture, that is approach to you can say splenomegaly. A very important topic, by the way. This approach to splenomegaly is also very important topic. Okay, so we will go in the same way. First of all, we will study causes of splenomegaly, and then if when we know the causes, of course, we can talk about the history and talk about all these things. Okay, so the causes of splenomegaly, by the way, guys, there are many causes of splenomegaly. Okay, so that's why in some of the books, for example, we divide them in this way, that like spleen. One of the thing about spleen I will tell you is, clinically, when we see the spleen, we see like how much it is enlarged. Okay, And normally we cannot palpate the spleen, but if we can just palpate the spleen, we call it as you can say, um, like, just feel the or palpate the spleen. It means it is, you can say, mildly enlarged. Okay, we can measure as well, and if the spleen is enlarged, and like after palpating you measure the spleen and you found like this one is around, or by ultrasonography if you measure the spleen, you found like nowadays it is up to 20 centimeters, it is called as moderately enlarged. If the spleen size is more than 20 centimeter, we call it as it is massively enlarged, so severe splenomegaly is there. So why severe splenomegaly is important? A very important thing I will tell you. Okay, clinically, if you're not taking help of ultrasonography, any splenomegaly which is crossing the midline, okay, where is the spleen? The anatomic location. The spleen is on the left, under the left rib cage, under the diaphragm. So if the spleen is so much enlarged that the midline of your tummy, your line or linea alba, like where is your belly button is, if it is crossing that midline, it is called as massive splenomegaly. Okay, so this is how we, you can say, diagnose. Okay, a very important thing, a very important viva exam question. Many professors, they love to ask, like, even when I was doing my MRCP, like, this question, they asked me this thing. Can you tell us what are the causes of massive splenomegaly? Okay, so it's a very favorite question of what you can say, different professors. Okay, so we can divide the causes of splenomegaly into different categories. For example, uh, uh, sometimes there is increased demand for splenic, you can say, splenic function. Okay, like simply the spleen become hyper functioning in this one. And what are these conditions? I talk about these conditions like in my other lectures as well, that it could be hematological causes in which the spleen demand to work more is increased. It could be in different infections or infectious causes. It could be in inflammatory conditions. Okay, so this is like one of the thing, you can say, which is important. Then one of the causes of splenomegaly is congestive, like there is congestion in the spleen, and that's what is getting enlarged. And the third is infiltrative, like there are different conditions which are called as infiltrative conditions, and basically what happens, they infiltrate the kidney, and the kidney become enlarged. Okay, so which can be again malignant and non-malignant. There can be infiltrative malignant conditions, or there can be infiltrative non-malignant conditions. Okay, not so hard concept, guys, so easy. And so you can say that the non-malignant conditions are basically, many of them are metabolic conditions, but non-malignant is important, so that we can put more and more causes in that one. That's why I write non-malignant. So hematological causes, what can be the hematological causes of increased demand of spleen? um, See, hemoglobinopathies, in which like the hemoglobin is abnormal and the spleen is destroying more and more of them, so it is hyperfunctioning, it get enlarged. Hemolysis, spleen is destroying more and more and more cells. Phagocytosis, and I think many of the things you will now understand. The cells are round in shape and the spleen have to destroy more and more of them. Okay, so anything like elliptocytosis, all these things, in this one your demand is increased, like the spleen have to work more and more and more. Infectious causes: any viral, any bacterial, any parasitic, any fungal infection can cause. Guys, a very common parasitic condition, especially in Southeast Asia, South Asia. If you know malaria, many sub-Saharan African countries, malaria is endemic. So whenever they have malaria, the patient's spleen get enlarged. Viral, EBV, CMV, HIV. Bacterial, TB. Parasitic, malaria. Fungal, though not so common, but there are many. Okay. So parasitic, malaria. Then in Africa, there is a condition which is common called as leishmaniasis. Okay. So see, both of these conditions, spleen have to work more. Inflammatory conditions, systemic lupus erythematosus, sarcoidosis you can put in this one. Then there is Felty syndrome. Again, when you will study rheumatology, you would know what is that. There is Still's disease, which I already teach you in pediatrics. Okay, all this one can. Talking about the congestive causes, in which there is congestion. Okay, talking about the congestive causes, in which there is congestion in the spleen. What is the thing? Sorry, wait. Okay, very important, portal hypertension. In this one, the spleen become congested, full of blood, or portal vein obstruction is one of them. Okay, or sometimes splenic vein thrombosis. Story is simple. When there is splenic vein thrombosis, what will occur? Blood cannot drain out of spleen, and when the blood cannot drain out of spleen, spleen will become congested and become enlarged. Okay. Malignant causes. Remember all the leukemias which we will study in the coming lectures. CML, CLL, lymphomas, lymphoproliferative conditions or diseases, Hodgkin lymphoma. I'm taking these names because our coming lectures are about these topics. Okay. Lymphoproliferative, myeloproliferative, Hodgkin lymphoma, all these things can. And the non-proliferative causes, non-malignant causes, it could be a cyst in the spleen, amyloidosis, infiltrative condition, sarcoidosis, infiltrative condition, hematomas, okay, and all the metabolic conditions. Metabolic conditions. What kind of metabolic conditions? See, all the lysosomal storage disease, glycogen storage disease, Niemann-Pick disease, all these diseases can cause splenomegaly. One of the mnemonic to remember the cause of splenomegaly is what? Funny one. China. China is one of the mnemonic. C is for cirrhosis. Of course, that will lead to portal hypertension. Okay. Which will lead to splenomegaly. Or you can write in bracket portal hypertension. H is for what? Hematological. See all this one. All this one. I is for what? Infections. All this one. N is for what? Neoplasms. All this one. Okay. And A is for what? autoimmune, all this one. So again, like a very important mnemonic to remember the causes of splenomegaly. But the question, which most of the vivas, or I have seen, like the people, they love to ask about. They ask you what 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 are the causes of massive splenomegaly? Okay, and the answer is very, very, very simple. Remember four conditions in which, like, the spleen, or three conditions in which the spleen can enlarge too much. CML, chronic myelogenous leukemia, myelofibrosis, and the third one is malaria. In this one, the spleen become massively enlarged. Okay, these are the three causes which you can think of. Okay, if you have done this thing, see, what are the history points you have to ask the patient? For example, anyone who comes with splenomegaly, or when you do the examination, you found that they have splenomegaly, what are the main history points you have to cover? If you know all these causes, CHINA, what is C? Cirrhosis, okay? So, of course, you will see the signs on examination. So, I will write over here, by the way. Okay, sorry. I will write over here. Wait. Examination, okay? So, in history, what are the important points you'll ask? In examination, what are the important questions? The first one is, C, China. C for chronic liver disease. So when you will do examination, you look for signs of chronic liver disease. Okay. H, hematological. Ask about what you can say, constitutional symptoms. Same thing. Okay. Which we'll talk about the same. Ask for symptoms of infections, fever and anorexia and all this stuff. Of course, or malignancy also. I should write over here, malignancy. Okay. Ask about history of liver disease, hemolytic anemias, or exposures. Okay. There are many causes, which can, like all these things, exposures, TB, for example, malaria, for example. Okay. So, ask for signs of chronic liver disease. Ask for jaundice. Look for jaundice, sorry, not ask. Check for petechias and purpuras. Why? Because, blood cancers or hematological cancers, they can lead to decreased in platelet formation, which can lead to what you can say increased bleeding. Ask for these things, okay? And look for other signs in the body, like lymphadenopathy or hepatomegaly. What we are doing, we are simply searching around what can be the cause of splenomegaly. Okay. History of exposure, of course, you will look for malaria. Travel history is very important in this one, right? HIV. So Of course, like all the things, all the causes you have to think about, then you have to ask for the questions. Okay. So to talk about that, whenever we, what you can say, we examine the spleen. Okay. Whenever we examine the spleen, uh, what we do is uh, when we palpate, first of all we inspect the abdomen, okay, and then we go for palpation. And in palpation, of course, we palpate the liver, we palpate the kidneys, okay, and we palpate the uh, spleen. And why we do this, of course, just to see either the spleen is enlarged or not, okay. So there are different way, and then we percuss also, by the way, okay. So there are a few signs, which you can see in the examination. One is called as Castell's sign. Okay. So basically, Castell's sign is used to see either there is any hepatomegaly or not. Okay. So uh, again, YouTube is the best way to see Castell's sign, how we see. But when the patient is in supine position, first of all, we ask the patient to do full inspiration. Basically, when they do inspiration, of course, the lungs, they come down, and then we ask the patient to do go into full expiration. Okay. So while the patient is doing full inspiration and full expiration, we keep on percussing the lowest intercostal space, that is eighth or ninth intercostal space, in the left anterior axillary line. Okay. So while percussing like this, and the patient is doing full inspiration and expiration, we look like either there is any change in note or not. Okay. For example, if there is resonant tone on full expiration or dull tone on full inspiration, because when the patient will do inspiration, the spleen come down and forward. So it comes under our percussion note. So that means like the spleen, now you are percussing the spleen. Okay. So the resonant note which we hear on full expiration is due to what? Because there is now air inside, especially the air, because spleen is gone up. Okay. So and when the patient will do full inspiration, so of course the spleen will come down and a little forward, and it will come under our finger or the percussion note, and the note will become dull. Okay. So if we see this thing, it means that the patient spleen is enlarged. Okay. So this is called as what? This is called as Castell sign. Again, YouTube is the best way to see. Okay. Then there is something called as Trobes space. Trobes space. Okay. Now, what is this one? Again, this is this is a space which have some importance when we are doing examination. It is crescent shape of space. Okay, and basically formed by the lower edge of the left lung. Okay, and the space is formed by the lower edge of the left lung, the anterior border of the spleen, and the left costal margin. Okay. So, uh, what is the importance of this one? That one way, as I told you, it is Cassel sign, to check like as there any splenomegaly or not. These are clinical skills, guys. But nowadays, of course, there is the use of what you can say ultrasonographies. They use, and they can evaluate quickly. But not everyone we have this one. Okay. So basically, under the Trobes space, you can see the photograph, okay, of Trobes space. There is stomach beneath that, okay, and if we will percuss that, of course, we will get a tympanic type of or resonant type of sound, okay. But if we are percussing the trombus space, and we are getting a dull tone. Okay, so it indicates that there is what you can say splenomegaly. So this is trombus space, which is again have a clinical significance. What you can say to see. One is Nixon sign as well, but guys, that is not so important. Okay, uh, like this is you can say a little similar to Castle space, and many of the books they don't mention Nixon space. By the way, Nixon sign. So in this one, the patient is basically put on his side, and we start the percussion. Okay, left costal margin, of course, and like from down we go upwards towards the head of the patient. Okay, okay, and we travel, we go with the costal margin. So and then like if there is like dullness to the percussion, we say like there is splenomegaly, but Dixon sign is not important. So I don't think so like you have to like go in more detail of that. Okay, so like these are the examination points, but of course like as you are getting this online lecture, so better to go for and like look at YouTube video to understand that thing better. Again, like investigations, you can say which we can do in the patient of splenomegaly. Now, again, if you know the causes of splenomegaly, you can write down all the investigations. I will try to write down. Maybe I will miss something, but again, I will start with CBC. I will go for ESR and CRP. I will go for blood film to see any abnormal cells. Okay, I will go for LFTs because cirrhosis is one of the cause. Okay, I will go for clotting profile as well. I will go for reticulocyte count in this one. Why? Because maybe there is increased turnover of the cell and the spleen is working too much. So that's why there is increased turnover of the cell. Infections, mononucleosis, or the infection which is called by Epstein-Barr virus or kissing disease, we do monospot test for them. Okay, monospot test, sorry, this one, monospot test we can do for them. Rheumatological diseases, collagen vascular disease, again we will do serology for workup of rheuma conditions. Okay, we can do this thing. Ultrasonography we can do. Ultrasonography will be very helpful in this case. See, ultrasonography is basically for all the abdomen. You can assess the liver. You can assess like if there is any portal hypertension. You can assess if there is any ascitic fluid. You can assess if there is any what you can say uh, portal vein thrombosis. You can also assess like the size of the kidney. Sorry, not kidney, spleen. So this one is like very, 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 very important type of investigation. Of course, you can measure the size of the spleen as well, and of course, like you can do CT scan. Okay, that will tell you more about like more detailed view of what's inside the abdomen. Okay, so this is about splenomegaly and lymphadenopathy. Very important topics. Before going on into more conditions, okay, especially what you can say cancers. So that's why I started this one. Uh, so of course, like after this, we are going to start with the um, what you can say different type of hematological cancers. Okay. So thank you for listening, guys, and hope all of you are fine and enjoying